Sadc Ministers of Health and Ministers responsible for HIV and AIDS held a joint meeting at the Elephant Hills Hotel, Victoria Falls in Zimbabwe from the 12th to the 16th of January 2015. The main purpose of the joint meeting was to review progress in the implementation of regional policies and programs for addressing public health issues in the region. The chairperson of the Sadc Ministers of Health, who is also the Minister of Health and Childcare of the Republic of Zimbabwe, Honorable David Pranyatwa, officially opened the meeting.
It's my singular honor and pleasure to welcome you all to this city of Victoria Falls. You have been told it's one of the 7 wonders of the world, and indeed it is, and while you are here, don't miss out on that opportunity.
The minister outlined achievements and challenges recorded by the region in the fight against major communicable, emerging and re-emerging diseases, especially the Ebola virus.
Sadc, among other regional groups, is one of the very united groups. And whatever we say, even within Africa, is well listened to. And I hope we can keep it like that.
The Sadc region continues to experience a huge burden of communicable diseases. The big three, namely HIV and AIDS, TB, and malaria, remain the largest contributors to morbidity and mortality across Sadc.
The Sadc region continues to be the epicenter of the epidemics, from malaria to TB and HIV. In order to achieve the control and elimination, an extraordinary and collective regional and global action is required.
We still continue as a region to be the epicenter of the communicable diseases, such as HIV and TB and malaria. So we still are there. We still need to fight this in a passionate way. Don't be dissuaded. Don't be told that HIV is now better. Yes, it may be better, but don't let that divert our resources from HIV. Let's continue being focused and continue to look at that triple disease burden of HIV, AIDS, malaria, and TB.
The ministers also took note of the rising burden of non-communicable diseases and the need to address them.
And of course, you are all aware that the other diseases are coming in, the non-communicable diseases, so let's not forget that. They are there, and you as Ministers of Health, you are burdened with that. What are you going to do about cerebrovascular aspects that seem to be increasing and coming at younger ages? You must look at that. Cancer, issue of diabetes, and other commonly referred diseases that are referred to as lifestyle diseases. So we need to look at that in Sadc in a very resolute way.
Ministers further reviewed and approved key strategic documents that will guide Sadc public health priorities and for regional cooperation and integration. In this regard, ministers approved key documents including the following. 1. The Sadc Code and Action Plan of Conduct on TB in the mining sector. 2. Minimum standards for the integration of sexual and reproductive health and HIV in Sadc. 3. Framework of action for sustainable financing of health and HIV in Sadc region. 4. The establishment of public-private regional partnerships in complementary health financing. In addition, consultative meetings were held on the sidelines with key stakeholders including international cooperating partners and the private sector.
We need to have innovative financing such that we put money into the responses for the 3 diseases. But at the same time, it's a global solidarity such that we need partners from within the continent and from outside.
The private sector has a special role to play in terms of the fight against HIV, TB, and malaria, and how they can integrate, how we can integrate those 3 conditions. And then they are there to help us raise resources, not just singularly, but as part of complementing other efforts that are already happening. And we also emphasize the fact that as a region, we need some self-sufficiency. We need to be able ourselves to say, this is what we have raised, this is the direction we want.
Participants appointed Sheila Klo, Director of the UNAIDS Regional Support Team for Eastern and Central Africa, to lead the establishment of a task team with a mandate which includes creating a private-public trust fund and proposing innovative funding mechanisms.
Julius Caesar once said to the emperor, I bring you Carthage, well, I bring you the private sector. For once, the chief executives from within South Africa, or Southern Africa, but also from beyond, to be able to discuss with us how we collaborate for 2015 and beyond.
I think it's a really positive step that the private sector is here today. I hope they can bring some innovative financing solutions to support the Sadc regional health agenda. And I believe that a good outcome of this meeting would be a private sector working group or task force that would help to drive forward a regional trust fund, amongst other things.
Our purpose for being here is to build a better partnership between the private sector and all the other actors in health, but particularly the governments. We believe that the future for healthcare lies in partnership between public and private. And in doing that, we have to find the best of what we both have to offer. And we have to find a way to combine that for the benefit of the people, the community.
Much remains to be done. The Global Fund obviously will continue to support all of you in your fight against the 3 diseases. There are 4 areas I'd like to highlight. Cross-border issues and cooperation, increased engagement with the private sector, increased domestic financing, and working together for a successful next Global Fund replenishment.
The ministers also participated in the commemoration of Sadc Malaria Day, held on the 16th of January 2015 at Monde Primary School, Victoria Falls, under the theme, Strong Partnerships, Sustain Gains in Malaria Control. And the slogan was, Combining Efforts, Key to Success.
Our theme this year is Strong Partnerships to Sustain Gains in Malaria Prevention and Control. We must sustain the gains. There's no point having gains and then 2 years later you go down the road.
My task is very simple, is to cement the relationship that we as private sector has with the public sector. We, in our theme, are saying a strong partnership, and we need to sustain the gains that we've had or achieved in malaria.
So malaria does not just affect your physical health, it affects your economic health as well. There's no doubt you can't go to work if you've got malaria. So this affects you very, very. The private sector have cooperated and joined the fight against malaria over the years, and we think that they are going to sustain this throughout the fight that we're going to be having.
We as a private sector are not going backwards. We are continuing with the war against malaria. Not only malaria, but other diseases as well. But here today we focus on malaria.
Last year, the report says 198 million malaria cases were reported worldwide. 198 million. The malaria chat. And of those, half died. 548,000 died of malaria. And further to that, which is most worrying, 90% of all those cases are in Africa. China, malaria, India, but 98% of those cases are in Africa. And more worrying, 78% of those cases, of those who died, are children under 5. That is why we are worried about malaria. Yes, we've made gains, but they're still killing our children, killing pregnant mothers. And we're here in this generation allowing that to happen.
The main outcome of the meeting was that it was imperative to work collectively, considering that issues that affect individual SADC member states have a bearing on the whole region. It was also agreed upon to strengthen collaboration between the private sector and other key development stakeholders.
What we have realized is that we have not been using or utilizing the private sector like we should, both internally as countries and externally. We have been relying on partners as donors and international organizations, but our own private sector within our own countries
except a few countries. But we have not really mobilized and used the private sector. And this initiative for the health system will go a long way. And we are looking forward to its fruition.
Honourable Ministers, the majority of these communicable diseases are preventable and treatable. However, the reality is that at the moment, HIV/AIDS, malaria, and TB remains a fatal disease that neither knows nor respects borders.
HIV, AIDS, TB, etc. are not diseases for individuals. And part of what we're discussing in this conference, when we met with the private sector and the International Office on Migration, one of the themes was that diseases know no borders. They move across the, we're dealing with malaria now. You can't impose passports on mosquitoes. So countries have to cooperate and work with each other.
I would very much want to thank the Minister of Health in Zimbabwe, who is the Sadc chair, Dr. Parenyatwa, and also the Permanent Secretary, and all the teams that organized to make this meeting a wonderful meeting that came out with very important outputs, which the region is going to use going forward.
So as chair, during 2015, Zimbabwe will continue to play its role to ensure that the Sadc health agenda is visible and its implementation is fast-tracked. I think this is an appropriate use of the phrase fast-tracked. We want it fast-tracked so that we achieve a lot more.